Here we are back with another publication review. My boss actually sent me this paper about 2 days ago. He told me he found it on Reddit, so shout out to Dr. Robert LaPrairie for sending me this paper, and let's get into it. Title is Harnessing Psilocybin. Antidepressant-like behavioral and synaptic actions of psilocybin are independent of 5-HT2AR activation in mice. Some general background information, what the paper tried to discover. So basically, the FDA has given psilocybin a fast track designation as a treatment for depression. This has been well established and certainly blowing up in the mainstream media as of lately. The major factor for psychedelics is that alteration in sensory perception and consciousness. This requires about a 6 to 8 hour therapy session where the patient needs psychological support to undergo this quite intense experience. And because of the time duration of these experiences, this is quite costly. And this is one of the sort of challenges that we'll have to deal with in psychedelic therapy. And we know that activation of 5-HT2AR or serotonin 2A receptor activation leads to these alterations in sensory perception. So the sort of psychedelic effects, so to speak, that you experience when you take a psychedelic are due to serotonin 2A receptor activation. That is what we know. The question here really becomes, is serotonin 2A receptor activation necessary for the therapeutic potential of psychedelics? I.e., if you block the serotonin 2A receptor with some sort of drug and then administer the psychedelic, would you still see the antidepressant effects of the psychedelic compound, or do you need that serotonin 2A activation in order for psychedelics to have any therapeutic potential? And you can test this. You can actually use an agent called ketanserin, and it blocks serotonin 2A receptors. And then you can administer a psychedelic, and you can see whether or not there was an antidepressant effect of the drug. And if this were so, it would prove that you don't need to activate serotonin 2A receptor in order to experience the antidepressant effects of psychedelics. And here is the experimental setup. I will be giving a general overview as opposed to an in-depth detailed experimental setup. If you want to read that, I'll leave a link in the description. Here's sort of my synopsis. Basically, mice love to drink sucrose water. In fact, they almost always prefer to drink sugar water over normal water, always. And they also prefer the smell of female urine over male urine. This is likely due to we as biological beings have the drive to reproduce, and if the male mouse smells female urine, it probably means there's a female in close proximity, so they much prefer that smell over male urine. It has been well established that a depressed mouse won't have these preferences. They don't care that the sugar water over normal water. They don't care that it has sugar in it because they won't get any pleasure from this due to being depressed, and they don't necessarily care about the smell of female urine because if they're depressed, they probably don't care to reproduce either. So basically what you can do is you can expose a mouse to a chronic multimodal stress paradigm, then give it a psychedelic. Basically, you can cause the mouse a lot of stress, and then you can give it a psychedelic and see whether or not its preferences change. If you give the animal a psychedelic and its preferences go to the normal default one where they prefer the smell of female urine and sugar water, they likely don't have the stress anymore. I know that's quite simple. And if they don't necessarily care, they don't care if it's sugar water and they don't care that it's female urine, they'll just smell the male urine or drink the normal water, they're likely still depressed. So you can use this as a metric in measuring depression. So let's talk about the results. There are two sort of tests that we talked about. On the left is the sucrose preference test. On the right is the percent female urine preference. Then there are four groups. The four groups are vehicle-treated mice, which is you're not really treated with anything. You're treated with basically nothing. Ketanserin is also used as a control. This is the serotonin 2A receptor antagonist, which blocks the function of that receptor. That should also give us no effect. vehicle plus psilocybin, this should give us an effect. And then cantancerin plus psilocybin, which is really what the study is testing, is the combination of cantancerin, which is a serotonin 2A receptor antagonist, plus psilocybin, will this exert an effect on the animal? So we can see for the sucrose preference test, when we give the animal vehicle and cantancerin, we see no effect. But when we give the animal, so in yellow, vehicle and psilocybin, and then separately cantancerin plus psilocybin, in yellow we see an effect. Okay, you see a statistically significant effect in both the percent sucrose preference and also the percent female urine preference. So this really tells us that, in a way, psilocybin by itself and also separately psilocybin and cantancerin are both equally effective at treating this sort of animal model of depression. So basically what the publication discovered is that you can block serotonin 2A receptor activation, still get an animal out of a depression-like state. But the paper was curious as to, that's really cool and that's great, but why? One of the hypotheses they tried to push forward is that in addition to psychedelics activating serotonin receptors, it can also lead to activation of AMPA receptor. AMPA receptor is a subtype of a glutamate receptor, which is also, glutamate receptor activation has also been shown to be misregulated in depression. So what we're looking at is basically if we have these animals that are in a depressed state and we treat them with vehicle and psilocybin and then ketamine and psilocybin, will that AMPA or glutamate receptor activation increase or decrease? And what we can see is that in the vehicle treated groups and ketamine treated groups in gray and blue, there's not really a significant activation of the receptor. But once we increase, we put vehicle and psilocybin in there, and then ketamine and psilocybin, you see an increase in activation of those receptors. And this is sort of the hypothesis that the paper pushes forth, which I think is really interesting. So it's because overall it suggests that we might not need drugs that activate serotonin 2A receptor that can be used to treat depression. I think it's quite interesting, and I hope this idea gets further explored eventually when somebody makes a drug that can try this in a human clinical trial. I think that'll be really exciting, but for now this is all speculative because it's in animal models, which is not a perfect representation of a human being, right? So I think it's interesting to realize limitations on publications when we're trying to talk about how this correlates in human research. And until next time, stay curious.